Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is what you need to know about acute and chronic back pain. Over 90% of Americans will experience back pain at some point in life. Regardless of whether or not treatment is sought, 90% of that back pain gets better within 6 to 12 weeks. An unfortunate few will end up with chronic back pain. The definitions are acute back pain is 6 weeks or less, subacute is 6 to 12 weeks, and chronic is when it occurs for over 3 months. Back pain is the second most common reason for doctor visits, just behind the common cold. Half of all working Americans admit to having back pain each year. It's the most common cause of disability worldwide, and the direct and indirect cost in this country annually is over $100 billion. So I'm going to go through the most common causes of back pain. First we'll do the soft tissue ones, then we'll do the hard tissue ones, the bony ones. So most common by far is a back sprain or a strain. This could be anything from a fall to you're moving your house on the weekend, you strain your back. Could be a sneeze. There's different levels of severity. A back sprain is when you injure a ligament in your back. Okay, there's a lot of them, and you may just kind of tear one, or you could just fray it a little bit. A strain is when you injure a muscle in your back. There's a lot of them too, called the paraspinal muscles. Most doctors after medical school slowly forget that there's a ton of them. They just call them the paraspinal muscles. Now, disc degeneration, a normal disc consists of 80% water and 20% proteins and collagens. It has a harder outer layer called the annulus, a gelatinous inner layer. When you start to get degenerative, you lose some of that 80% water. Here's a healthy disc, and it starts to get compressed, okay, and bulge, and arthritis starts to occur. Now, that's not necessarily painful, but 40% of the time when a person has back pain, it's due to a degenerative disc. If you have bulging disc from degeneration or a disc tear, such as you see here, that can cause significant back pain. A disc herniation is when some of the inner material actually squeezes out and pinches on a nerve root. That can lead to back pain from the disc tear and leg pain from the inflammation around the nerve root. Sciatica, you can see the sciatic nerve is 3 different nerve roots, L4, L5, S1, coming together forming the sciatic nerve. If a person has either a bulging disc or a herniated disc that pinches on a nerve root, as mentioned, that can cause back pain because of the tear, and there are some nerve endings up in this outer layer. But it may also cause sciatica with pain down the back or the side of the leg. Moving into the bony causes of back pain, number 1, far and away, arthritis. Okay, there are lots of joints in the back called facet joints. There's one on each side from the neck all the way down to the sacrum, and those can be a tremendous source of pain. There are 2 sacroiliac joints in the lower back. Here's the sacrum, here's the ilium, which is part of the pelvis, and that's the sacroiliac joint. It has cartilage, it's prone to arthritis on one side or both, and 12 to 25% of the time, that's the source of your back pain. Scoliosis as an adult is typically due to degeneration of both the disc and the facet joint. That can cause a lot of back pain because of that. It can also cause leg pain because on the concave side, where the nerve roots are trying to get out, they can get pinched. That leads to spinal stenosis and leg pain. Spondylolisthesis is when one vertebrae slips on the one below it. It's typically due to degeneration, and it's very, very common. Okay, it can cause significant back pain because of the arthritis, and it can cause some leg pain because the nerve root that's coming out here sometimes gets traction pulled on it as this vertebrae goes forward. All right. Spondylolysis involves a stress fracture of one of the area of the vertebrae. It's more common in people who are participating in repetitive activities such as football linemen, gymnasts, military. A lot of times the pain gets better on its own by just, rest and anti-inflammatories, or you may end up needing surgery to fuse that broken bone. And then spinal stenosis, which affects tens of millions of Americans. Arthritis overgrows bone in the joints of the spine, and also coming out from the vertebrae. It can pinch on nerve roots and cause pain in your back, buttock area, and thighs. Uncommon causes of back pain include infection, such as either in the disc, which is discitis, or in the bone, which is osteomyelitis. I put fractures in uncommon cause. It's really not. About 1 million of those occur, compression fractures each year. You can see one here, mostly due to osteoporosis. Okay, and then tumors can either be primary in the spine, such as multiple myeloma, or they are often metastatic from breast, lung, prostate. The top non-operative pain management in the Dallas-Fort Worth Metroplex area is through the Texas Pain Network. There are several clinics accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.